Hello, I will tell you about a condition called Warthins tumor. Generally, we all have three sets of salivary glands. So, these salivary glands, they produce saliva. Approximately 1 to 1.5 liters of saliva is produced every day. So, as you see in this picture, we all have three sets of salivary gland. One is a parotid gland as shown in the picture, which is seen here below the ears and around the ears. Here one pair. Then submandibular gland, one on each side, and sublingual gland, which is seen below the tongue. These are the three sets. So, this Warthins tumor, which happens to be a benign tumor, it is seen only in parotid gland. It's a benign tumor. Generally, when you talk about diseases or conditions of parotid gland, these diseases or condition can be congenital condition, which starts soon after birth, or it can be trauma related, or it can be infection, let it be bacteria or viral or protozoal whatsoever, or it can be benign condition, and the last one being it can be malignant. So, malignant means cancerous. Means it will destroy the local area and it spreads to different parts of the body also. So, what is benign condition? Benign condition is a condition which cannot be treated like an infective condition, and it is not as dangerous as a malignant condition. So, it produces local effect wherever it is, and it has to be removed. Otherwise, there is a possibility that it can turn malignant. So, if you ask me which is the most benign condition in parotid gland, the answer is going to be pleomorphic adenoma. I put a separate video on it. If interested, we can go through that. That also comes in part 1 and part 2, same like this one. So, the second commonest benign condition in parotid gland is Warthins, and we are going to talk about Warthins. So, Warthins tumor, generally it is seen in males, more than females, seen in males. And the age group, if you see, it is common above the age of 50, between 50 and 60, between the age of 50 and 60, and sometimes we see the Warthins tumor on both sides, at least 10 to 15%, it will be seen on both sides. So, this is what I have written here. Now, is there any association with any condition? It may be seen, and maybe it is more common in smokers, and the possibility of this benign condition being malignant comes in when there is a history of radiation. These are the two associations. So, now we will go in for the complaints. What will be the complaint of the patient? Usually, most of the patients, they walk into ENT and OPD saying that there is a small swelling which is seen here, which is slowly growing over weeks together. This will be the most common complaint. Sometimes it so happens that this swelling can suddenly increase in size. Then they rush to us saying that we had this swelling for a few months or 1 or 2 years, but suddenly of late for 2-3 days it has increased in size, and I have pain in it, and I have pain in the same side here also. So, why this has happened? Because this benign tumor can suddenly undergo cystic change, or maybe there is a small hemorrhage or bleeding inside, but more common being a cystic change. So, it increases in size. That is the reason for it. So, if we happen to put in a needle and take it out, a brown color fluid will come out. That will be the common. Now, the examination part. So, when we examine, say like he does not have any other complaint, only the swelling, at that stage we are examining. In that case, when you examine, you find a small swelling over the parotid region, and the skin over the swelling will be normal, and when you palpate it, we can measure it, and the edges can be well felt, and the facial nerve of that side is normal. The facial, there is no asymmetry. So, why I am telling you about the skin covering and it is not painful to touch? Because if it is painful to touch and if there is a skin discoloration of red, means it is infective. When this is not there, then means it can be more favorable of being long duration, it can be more favorable of a benign condition. So, that is the examination finding. Now, sometimes what happens is, this benign condition, Warthins tumor, can have at the same time another tumor, benign condition. That is, pleomorphic adenoma can be seen at the same time. So, it can be seen at the same time, or it may develop after a few months or after a few years. Now, coming to the investigation. The most important investigation will be ultrasonography of the neck, which includes the parotid. There we will definitely come to know it's a parotid swelling and the characteristics of the Warthins tumor. Now, at the same time, we will ask for a test. We will put in a needle inside the swelling, take out the cells and give it for histopathological examination. That is called as fine needle aspiration cytology. And the report usually comes in 3 to 4 days. It will give us a diagnosis. These are the two important investigations to be done, and this is more than enough. Sometimes some of the surgeons, some of the ENT specialists would like to go ahead and do a MRI scan too, so that it helps us more. Sure, we are going to go ahead with surgery, so it's going to help us more. In few conditions, we do need MRI scan, like the patient presents to us with a sudden swelling, or he has got a swelling for a long time, he has started developing pain of late, and he has got a swelling for some time. Now he has got facial asymmetry, and there are some skin changes, associated changes, and these conditions we want to rule out whether it is malignant or not. So we will of course go ahead and do a special type of MRI scan, diffusion weighted images. So if you ask me if MRI scan is better, CT scan is better, the answer is going to be MRI. And the second question is, suppose the person is not able to afford MRI scan, which is costly. Can I compromise with CT scan? Yes, you can. But MRI is better. If you can do CT scan, well and good, no problem. Now you have one more investigation, that is, which is done in nuclear medicine department, which is not must, but if you so happen to do it, peritectinate scan, it will show a hot spot which is diagnostic of Warthins tumor. And before taking to the winding up all the investigation, we will put in an endoscope into the nose, down the throat, to have a look whether the deep part of the gland there is a swelling or not. So these are the common investigation which is done. Now, if we leave this condition just like that, what is going to happen? I said it is benign. It is not malignant. So why not leave it like that? No. So what happens is, this may grow and there is a possibility it can turn malignant. And one of the common questions being asked is, if I remove it, will it come back? The answer is yes. The possibility is less, but there is a possibility that it may come back. So these are the two things which happens if you don't treat it. So do watch the second part, where I'll deal with the treatment. Thank you so much.